When Alberta Health Services was created, I was a VP and I led the Indigenous health portfolio for our province. And my role involved leading and developing Indigenous health and wellness programs and services across and throughout Alberta. I visited numerous First Nations communities, Métis settlements, engaging with elders and with grandparents, council members, and young people, listening, learning about their communities, fostering partnerships and relationships, and partnering on their essential issues and health concerns. Often people asked, how did this career start? How did it start? Well, it all started in a small log cabin in northern Alberta. I had visited cabins before, but as I drove down a dusty gravel road, this cabin looked to me like it was leaning heavily toward the creek. Also, worn and broken steps led up to the porch. It looked like I might fall through them. I parked my car. I looked at the nurses at the hospital referral one last time. Elderly lady, concerned about a sore on her leg, left without being seen. I grabbed my nurse's bag and I started walking toward the cabin. As a young, new community nurse, I felt alone and uncertain. I took a deep breath and I stepped up the steps. I knocked on the door. No response. I knocked louder. I gasped. An elderly woman's face pressed against the glass, staring at me, and she had an axe in her hand. I stumbled back and I ran toward my car and I stopped. Oh, I was breathing so hard. I was so afraid. Could I go back? Could I really go back? As I stood there, I thought perhaps my knocking made her afraid or scared. Yes, I could go back. I walked back. Tanze Mary, Muskikuskwees, little girl of medicine. That is what I was called. Often in cabins, when I would slip my shoes off, young children, little children, would slip their feet into them. And then they would giggle because they fit so perfectly. The door creaked open. I peered into the dim light, and Mary, a small elderly woman with jet black hair and long worn skirts, beckoned me to follow. The air felt close and dusty from the dirt floor. The bed was layered with quilts and blankets that rose up to the small and low ceiling. Mary sat down in a chair while I looked for one. Finding none, I settled on the dirt floor, facing her feet, ready to treat the ulcer on her leg. Mary looked down at me. I could see uncertainty in her eyes and in the lines of her face. It's okay, Mary. I'll be careful. I'll be careful. Mary watched me, and as the days passed, the doors would be left open for me when I arrived, and she watched me with her dark eyes. Eventually, we began to talk. She shared with me her stories of her early life. I was just in awe of the courage, the perseverance, and the resilience of living in a remote northern community. Now, I wondered who I would become, how life might unfold for me, and if I'd have the courage to face my own challenges, even if they were different. One day, Mary lifted her eyes and shouted, "Get out!" I startled and looked back. And there was a man in the shadows who quickly left. She told me he stole her money. She told me that she was worried that others were coming now that the town was creeping closer. I sensed her anxiety, and all I could offer her was my presence and care in the moment. As the days passed and I completed her treatments, we would sit on the porch under the warmth of the sun. Mary was more relaxed and calm in my presence. But as I got up from the bench on the porch, I always would ask her if she would like to have a bath at our health center. Always she said no. Seemed like she hadn't had a bath for quite some time, and I was eager to offer that towards her. As I left one day, I turned the key in my car to leave. She opened the door and stepped inside and sat next to me. As we walked through the health center doors, all the staff stared, hardly able to believe their eyes. Who was this small woman? You see, we mostly saw young families at the health center, and they were curious. Mary's fingers touched mine, and I took her hand. I could only imagine her feelings in this busy, noisy environment. In the bathroom, I poured in some bubble bath. And as the tub filled, I peeled away layers of her skirts, realizing that her stockings had melted with her skin. Tenderly, I teased away the stockings. I helped her into the warm, sweet-smelling water. I watched her play with the bubbles. In that moment, I saw a different Mary emerge. Before my eyes, I saw a woman who had lived through so much be joyful. Her joy was palpable. And as I talked and laughed with her as I knelt beside the tub, I could feel my heart being filled. After so much that Mary had been through, she had the courage to trust and find joy. Now, as a young nurse, I still had so much to learn, but I knew then that I would humbly learn from Mary and from all of my other patients. And you know what? I would be just fine.